Hello and welcome back to GastroVision. I am Dr. Qazi Sohail from Government Medical College, Srinagar. In today's video, we are going to focus on a crucial topic for liver and portal venous anatomy interpretation. That is, imaging of liver segments, especially left lobe of liver. This is one of the first landmarks you encounter during EUS evaluation of the liver, and mastering it is a key for understanding segmental anatomy, vascular branching, and even for interventions like portal vein sampling or targeting lesions. Station 1 refers to the level of the abdominal part of the esophagus just below the gastroesophageal junction. From this point, the ultrasound beam gives us an excellent view of the left lobe of the liver, especially segments 2nd and 3rd, and their relationship with the portal vein branches. Let's go through the imaging step by step using key frames. Here, in this image, the transducer is positioned in the abdominal part of the esophagus. You can clearly see the portal vein branches supplying segments 2 and 3 of the liver. As I have already mentioned it in my previous videos, the structures that come in the range of caudal end of the transducer will appear on the left side of the EUS image, while the structures in the range of cranial end of the transducer will appear on the right side of your EUS image. That means structures on the left are actually caudal, while structures on the right are cranial structures. Another important point here, structures on the right side of your probe will be seen on the right side of your EUS screen, while structures on the left side of your probe will appear on the left side of your EUS image. Once you sweep your probe clockwise inside the esophagus, you are going to see structures from left to right, anterior to posterior. The branch to segment 2nd is seen on the right side of your screen, as it lies more cranially and posteriorly, while the branch to segment 3rd is more caudal and anterior. That's why it lies on the left side of your image. This image is very important for EUS-guided liver biopsy or targeting portal venous sampling. Recognizing these two branches early helps orient you to the left lobe anatomy and is essential for further navigation. Next, let's move to another image, where we see one of the classic landmarks, the fisheye appearance of the umbilical part of the left portal vein. This is settled from the abdominal esophageal station, but now the probe is angled slightly clockwise to capture the umbilical portion, which is the horizontal segment of left portal vein. You can identify two key structures here. One is ligamentum teres, the remnant of fetal umbilical vein seen attaching inferiorly, so it will be seen as a leftward hyperechoic extension. Another is ligamentum venosum, a remnant of the ductus venosus seen posteriorly, seen on the right side of your EUS image. This fisheye view is a classic and reliable sign that confirms you are in the correct orientation. Now, let's look at this image. The imaging plane shifts to the visceral surface of the liver by slightly pushing your scope down. Here, you can appreciate how the ligamentum teres is firmly attached to the lower border of umbilical part of portal vein. Just beneath this region, you can also identify the umbilical fissure, which separates segment 3rd from segment 4B. This view is particularly important during liver segmental anatomy interpretation, because the ligamentum teres acts as a landmark for the left hepatic fissure and helps you localize segment 4B. Finally, let's examine this image, captured after a clockwise rotation of the scope near the left edge of porta hepatis. Here, you will notice that the umbilical part of the left portal vein now transitions into the transverse fissure. At this level, a very important vascular structure comes into view, the bifurcation of common hepatic artery. You can see common hepatic artery appears on the left side of your screen because inferior structures will be seen appearing on the left side. From this bifurcation, you can trace two major branches. One is right hepatic artery that is heading towards the right lobe. Here at this station, right means away from the probe and left means towards the probe. You can see left hepatic artery entering the transverse fissure to supply the left lobe. This arterial anatomy is vital for procedural planning, especially if you are considering interventions like TACE, portal vein embolization, and targeted therapy for HCC. To summarize, from Station 1 EUS imaging, we can sequentially identify key anatomical landmarks. 1. Portal vein branch to segment 2nd and 3rd. Basic orientation of left lobe vasculature. Second, the fisheye appearance of the umbilical part of the left portal vein, a crucial orientation marker. Third, the ligamentum teres and umbilical fissure. It is important for segmental division between 3 and 4B. The bifurcation of the common hepatic artery, that is entry of left hepatic artery into the transverse fissure. Understanding this step-by-step anatomy is essential for accurate liver mapping, staging, and planning any hepatobiliary intervention. In the next video, we will continue our journey with imaging from this station, focusing on deeper structures and their clinical relevance. Thanks for watching, and I will see you in the next session.